Hi, everyone. Thank you for watching today. I am really excited about our chat. We're going to be talking with Joel about mental health advice on the internet and on social media, and how we need to be a little more critical about what we see and take in, and the advice we take in. So yeah, hello, Joel. Thank you so much for being here.
Thank you for having me. I'm really glad to be a part of talking about this topic.
Awesome. Yeah. So, I mean, the internet and social media, it's been great because it has opened up the conversation about mental health, and we're talking about it a lot more. And there's a lot of social media accounts and content, whether that's, Instagram or videos or blogs, that are giving out mental health advice.
Yeah.
Now, although this is probably done with the best of intentions, not all of this is helpful. So, Joel, let's get into this. Like, what kinds of content and messaging have you seen that could be, misinterpreted or harmful when it comes to
Yeah.
mental health?
Well, I do want to echo that. Yeah, like having all of this information at our fingertips is absolutely amazing. I think it's helping to reduce the stigma about mental health and talking about mental health. It's definitely helping people talk about mental health. And I agree that there are a lot of well intentions out there, but there are still some messages that we have to learn to kind of interpret. And so I think some of the things that I've seen or that we've seen that I would say are things I want to look out for are messages that talk about kind of call like toxic positivity, where
Hmm.
they just kind of slam the idea that positive thinking is the thing that's going to help you fix or help you get through that thing that you might be struggling with, and kind of oversell the idea of positivity. Conversely, the other real challenge with that is the kind of message that says that not thinking positively enough is the thing that's kind of making you the way that you are, is the reason that this is happening
Right.
to you, this situation. So kind of that idea that positivity is something that we do talk about, but when it's kind of sold in this idea that it's the reason that something's going wrong or not well, or the thing that you need to do alone, that is kind of something that I would want to look out for.
Hmm.
That's something for sure I would want to look out for.
I think there's so many gray areas when it comes to mental health. It's not like, I mean,
Yeah.
with Instagram or social media, you're just getting, an image and a bit of a caption or a quick video, these little snippets,
Yeah.
um, where you can't really pack in the bigger picture, right? And
Absolutely.
yeah, so I just saying, like, have think positively, that in and of itself, that's not bad, but
It's not the whole picture. I think gray area is a lovely thing that you bring up, because that is where we want to be in the gray. We want to kind of understand that life isn't always black and white, or that there is some gray area. And I think a mental health professional can help you nuance some of those discussions. And I think that idea that it requires a little bit of nuance can be extended to this other thing that we kind of see, which is how people talk about or discuss or describe trauma. And that's a really big word. It's kind of a key word that people throw around quite easily these days. And I think it's an important word to talk about, because traumatic experiences and traumatic events are things that really do impact people. They can lead to mental health concerns. They can cause a lot of challenges. But that being said, trauma can come in a lot of different forms. And I
mhm,
think one of the things that I would want to look out for is how people talk about trauma, in that it's not just traumatic events or big things that happen. Trauma can also creep up on us. It can also be the result of a long-term relationship, or being raised or living in an environment that is neglectful or kind of harmful over time. Those can be described as and should be included in the idea of trauma. And so I think one of the things that we can look out for too is, again, that kind of all or nothing, black and white idea that, yeah, we talk about trauma, it can look like a number of things. And I definitely don't want to downplay any of those things that might not be the big ticket kind of trauma that people talk about.
right, and yeah, like you said, whether it's trauma or some kind of other mental health struggle, like depression, anxiety, whatever, there's so it's such an individual experience that
Mhm.
you can't um, sum it up with. with just, a couple sentences, like this is what, like this is the answer and what you need to help with it. It's just everyone experiences it so differently.
Absolutely, and I think it goes to kind of where using kind of social media and mental health, where they can kind of align, is that it's not complete therapy. Insta therapy is not complete therapy, but it can be used to kind of supplement, um, kind of be used as kind of maybe some healthy reminders. But a mental health professional, hopefully, was someone who would be able to tailor some of that more general discussion, or maybe that more general thing, and tailor it to your experience, to your preferences, and to what makes sense to you. I think that's
Right.
the benefit. Yeah.
So you kind of touched on this, but I mean, do you see any of these, kind of bite-sized mental health advice pieces that are helpful or beneficial?
Yeah. Well, I think the idea of getting getting the discussion going. Anything that can kind of clue you into your situation or the situation of a loved one that might encourage you to seek help, something that might say, like, hey, that sounds familiar to me. Or in the same way, something that kind of normalizes or validates us, because very often we might be experiencing something and it might make us feel very alone. It might make us feel like we're the only person on earth that experiences this. And sometimes those bite sized pieces of information might say, hey, you're not the only person that's experiencing this.
Right.
And it might help us kind of reference and kind of step outside ourselves and go, oh, I'm not the only person, or this is something that's, not okay. Maybe I can go seek a little bit of help. And so that's
Yeah.
where I think those bite-sized pieces can sometimes be really beneficial.
Hmm. So Joel, I've definitely seen content online, whether it's a blog post or a TikTok video, and there's sometimes coming from legit mental health professionals and counselors, where they give a detailed description of a mental health concern, could be depression or
Mhm.
anxiety. So if people are experiencing those symptoms of something they're seeing online, or they're curious about a potential diagnosis, what are some things, like, what are some important things that they should be aware of?
I love that you brought up the diagnosis question, because I think it's super important, that people, obviously, we don't want to self-diagnose and we don't want to scare people, but it is important to be
Mhm.
aware of what some of these things look like. That being said, if something that you're seeing about a diagnosis, let's say, resonates with you, if you're saying, hey, I've experienced some of these things, you do not need a diagnosis to go and seek help. Um, that is
That's
not
a great point.
necessarily something, yeah, like you don't need a diagnosis to go and seek help. That being said, even if you did get a diagnosis, that doesn't necessarily mean you're going to be helped or get help. And sometimes going to seek help, the purpose is not diagnosis. So
Mhm.
having an understanding that, if you're seeing something that resonates with you and it looks like a diagnosis, you don't need a diagnosis to go and seek help. That's something you can do regardless.
Yeah, I think that's such an important point to make. I think for some people, I don't know if reassuring is the right word, but it's like, I know from my doctor or from this person or
Yeah.
whoever that this is what I'm going through. So I don't know, it ties into, like, their identity or whatever. And yeah, like that might be the reason to seek counseling or help or whatever. But I think
It
that's
definitely
important.
helps. Yeah, it definitely helps to sometimes get some understanding. That is kind of something that people are looking for. Maybe some, again, that reassurance or that validation of, like, hey, this is actually something.
Yeah,
Sometimes the purpose of diagnosis is to communicate to other mental health professionals, or other services. So it does communicate some information, but it's definitely not exclusive,
yeah,
to
like if
get
you're
a book. Yeah,
having, a hard time, you don't need that title
yeah.
to get some help with what you're going through.
Absolutely, absolutely.
Yeah.
And a mental health professional, again, too, why kind of having these discussions kind of in the digital realm is good but not sufficient, is that a mental health professional might help you nuance that discussion to help understand, hey, if I do need a diagnosis or want one, what's the purpose of that? Why is that important to me? Is that something that I want to pursue? A professional might help you nuance that discussion.
For sure. So, Joel, what about like couples and like relationships, couples counseling,
Yeah.
that kind of thing? What kind of
Yeah.
messages are you seeing that could be inaccurate online?
I think this one is really comes up a lot too. Again, going back to the idea that it's never all or nothing, never black and white, never one or the other. So some things that we want to let you can kind of look out for is messaging that says it's like all them or all me. And so what that might look like on a message or in that content might say like, hey, if your partner is doing this, and this, then you have a toxic or an abusive relationship. Now, that might be very true, but the reality is we have to be able to also nuance how an individual is maybe contributing to conflict or participating in that in some way. And just again nuancing that, so just kind of thinking that it's all them. But the other side of that is messaging that says it's all me. If you're someone who's incapable of love, or you were raised this way, so this is going to be your challenge in being in a relationship, that puts a lot of responsibility on a person, that again might completely disqualify or discredit something else very real going on in the relationship or that individual. So when it comes to relationships and couple seeking counseling, messaging that I would look out for is something that's kind of either like all or them. We want that gray area.
Or yeah, like we've said, just kind of too simplistic. Like we like things that are digestible and these little lists that kind of wrap things up nicely with a bow. But yeah, like our mental health or our relationships, it's not that easy.
Yeah, absolutely. Yeah.
So you've kind of touched on this, but can the advice and mental health content we see online be a substitute for therapy in any way?
So I think it's important to nuance. Like right now, there are a number of phone apps or like programs on phones where you can access kind of a mental health service. Sometimes those are kind of skill-based things where they're helping you do something like a breathing technique or relaxation exercise. Whereas the difference between kind of working with a mental health professional is you have someone that you're talking to. And so I think it's important to differentiate those things. But in general, my personal opinion here is that anything that you're seeing online that is like content about mental health should be supplementary to your kind of greater purpose and greater ability to seek help. So, it's great to help inform people. It's great to spread awareness. But at the end of the day, I would hope that it would be supplementary. And really, if you think about, how we learn skills, you can learn how to, woodwork. You can learn how to build a table from a book, from an online course, from a YouTube video. You can learn lots from a YouTube video. But, there is also the ability to work with a professional, work with a teacher to teach you those skills, who is then, like I said, going to be able to nuance, bring something to you in a more relevant way to you. If you're someone who can learn kind of by yourself, that's great. But also a mental health professional might help tailor that work to you and meet you where you are.
Yeah, I like that word you used. It's tailored. It's customized for you and what you need and how best you learn. And
absolutely, you should hope so. And that's something that I think mental health professionals should strive to be able to do, is to be able to meet the needs, get feedback from their clients, to say what's working and what's not, so that they can bring to them services that are right for them.
So how can we be a bit more critical about what we see online? Are there any obvious red flags to look out for?
Absolutely. I mean, anything that gives a guarantee, when you're anything from buying a kitchen appliance to, a diet supplement, anything that's going to guarantee you something is something that you want to be critical about. Also, treatments or promises of treatments that kind of lock you into something, or that make you make a commitment, especially a financial commitment, that you would kind of give up if you weren't able to complete it. So I'm not saying that mental health, counseling or seeking mental health is something that doesn't require commitment. It absolutely does. But someone who might make you pay up all up front or something and lock you in without that ability to say, hey, this isn't right for me, that would be something that I would I would sway away from.
Tell me what you think of this one, because I've seen, and not just with mental health, but any kind of, self-improvement. I think we need to be really critical of who we're taking the advice from, and not just accept what they're saying based on the amount of followers they have. I've seen a lot of, guides being sold, or, ebooks or whatever, that you can purchase. But just because someone has a big following doesn't mean that they have the right credentials to be giving the advice that they are.
Yeah, absolutely. And I think, I appreciate you kind of bringing that up because I obviously took it for granted. I didn't answer with what I thought was the most obvious answer, which is know where your information is coming from, who
Mhm.
is giving that information, and what are their credentials. What kind of like legislative body or licensing do they have that protects you as a consumer? So there's the Healthcare Act. That says that there are a number of different titles that we can use as mental health professionals, psychologist, registered social worker, that protect you as in Alberta as consumers and kind of hold us accountable. And
Right.
so being able to like look for those kinds of information on the information that you're getting is really beneficial and really helpful. And then having a breadth, looking, I read an incredible amount of mental health books from myself and from my clients. I try and stay up to date on what the apps are out there that kind of support mental health. I would never just provide someone with one. And I think
Mhm.
the ability to take in a holistic picture, being able to access multiple levels of support, I think is the thing that I would make sure that someone is doing, and not just kind of sticking with one book or one
Right.
app. Kind of getting that whole picture.
Yeah. That's
Yeah.
a great piece of advice. So, speaking to parents,
Mhm.
how can we teach our children or teens to be a little bit more
Yeah.
discerning about what they're seeing online?
Well, I think, that question itself could probably be its own 20-minute
Right.
discussion about how we talk to our kids about what they see online. I think the things, obviously, so the standard ones about making sure that you're aware of being able to filter when appropriate the content that kids are seeing online, how much they are taking in, and just being able to have discussions or take necessary precautions so that you as a family feel comfortable about what somebody is taking in and how much of it they're taking in. At the end of the day, being able to have discussions with your kids about what they're seeing online is the most important thing.
Yeah.
So if you're doing anything that is stifling that conversation, that would be more challenging than your ability to, if your kid is seeing something online that brings up questions for them or they want to kind of get some clarity on, we would want to facilitate that or at least foster that discussion. So
Mhm.
helping kids recognize that what they're seeing online might be an ideal. It might not be, it might be really great to think about, but in reality, it might look very different if we were to try that.
Right.
Or it might look very different from our context. And so kind of helping kids understand that there is, it's great to be shooting for the stars. It's great to look at something and say that's like the coolest thing ever. And I really want to emulate that. But helping kids understand that there is a version of that that is right for you. And it might not look exactly like what you see online.
Mhm.
Mhm.
So, Joel, if someone's struggling and they're going about researching, available resources for them, what should they be looking for?
So there are a number of great resources for mental health in Alberta and around the world because of their access to mental health online. So obviously you want to find programs that are right for you, whether that's a financial commitment or a time commitment, something that can meet you where you are, and being able to kind of understand upfront what you're getting yourself into. So things that we want to look for are kind of clear understanding of what the costs are, what you're getting into, and being
Mhm.
able to talk about that. The Calgary Counseling Center has what's called a sliding fee scale, where we basically are able to bring counseling to people based on their financial need. Without asking too many questions, we want to establish what that is, and we don't want fee to be the reason or the barrier that's going to prevent someone from coming in.
For sure.
Most mental health counselors, I would hope, are able to be forthright with their fee. Some can be flexible like we are, some can't, and that's okay. Um, the other thing that I would then be looking out for is your ability to say no, or your ability to walk away from something and
Mhm.
give feedback. Is this working for me or not, or is this the right fit for me? Again,
Right.
Calgary Counseling Center, I think, does an excellent job at assessing and asking clients how their process is going, having discussions with their counselors. All of our counselors are trained to have discussions about, is this working for you? Um,
Mhm.
and is our relationship actually helping, or is it something that we need to address and change so that you can get the service that is right for you? So kind of assessing for is the person that you're going to be working with, are they willing to take that feedback? And are they
Mhm.
willing to, to swallow their pride and say, maybe we're not helping you? that is something that I would want to be able to have a discussion with a counselor or something. I think it's important.
Right. Well, thank you so much, Joel. This is an excellent conversation.
Yeah, I really appreciate you giving me the chance to kind of talk about this. I think it's a really valuable topic to be talking about right now.
Yeah, for sure. I mean, it's like we said, it's awesome that people are talking about mental health, but we just got to be careful of what we're taking in.
And being critical is where that starts from. So thank you for letting me speak to this.
For sure. Well, thanks everyone for watching, and have a great day.